Right, so the next conversation we're having, it has to do with COVID-19. COVID-19 has impacted the world in a major way, and COVID-19 is still with us. It hasn't left us. We have to get used to living with COVID essentially for a long time. So what's been happening is that there's a project that is gathering the stories of doctors and nurses involved in this COVID fight. And it's by Esther Ama, who has founded this project. It's called the Black Frontline. And she's joined us in the studio this morning. Good morning to you, Esther.
Good morning. Thank you for having me.
Thank you too for joining us. So this is a significant project. I'm not sure why nobody has thought about that until now, the fact that you're doing this, because the nurses and doctors have quite a story to tell.
They really do. They really, really do. And it matters that the doctors and nurses of Ghana are included when we think about the story of COVID and what has happened. All kinds of people have been affected in different ways. So I'm the executive director of the Ama Institute of Emotional Justice.
Right.
And our organization has founded this project, the Black Frontline, co-directed with Dr. Kim Gallen of COVID Black. And the aim is really very simple.
Right.
COVID happened to all of us, but we didn't all have the same experience. What has been the lived experience of doctors and nurses all over the world? So we're gathering those stories. We want 100 of them to come from doctors and nurses in Ghana. So 50 nurses, 50 doctors in Ghana.
Okay.
We're encouraging them to engage with us and share your story of what has it been like working through the COVID era. But it's not just about telling the stories. We use stories as a strategy to make structural change in the healthcare sector. President Akufo-Addo spoke specifically about strengthening the healthcare sector, expanding it. We saw the speed at which collaboration enabled us to build a medical center because there was a need. And so the doctors and the nurses are the people best placed to share with us what do we need to make the healthcare sector of the future better serve those who sacrifice every day and struggle to give us healthcare and those who they serve, the people of Ghana. And so this project is about making that happen.
So you're collating all these stories, you say from the UK, from Ghana, from the UK, from the US, and then eventually what happens to all the stories that you're collecting?
So then all the stories are gathered and they will be placed on a website, the Black Frontline website,
right,
which is a public website. That means anybody, anywhere in the world can now go and listen to a nurse or a doctor from Ghana, from the States, from the UK, sharing their experience.
So it's going to be audio-visual,
happened.
essentially?
No, it's audio. It's an oral history. So it's actually the largest oral history project of global Black doctors and nurses ever. It's the largest. And so the good thing is that all the identities are anonymous. And the reason they're anonymous is that we want those who participate to be able to be transparent and truthful.
And feel free.
And feel free to speak. And you know, sometimes we'll have to think about the institution that I'm working for, bosses, supervisors, and how they may respond to these stories. And so we want to make sure that they have the freedom to speak. So everybody, from 1 to 100, you'll just be known by narrator 1, narrator 2, across all 3 territories.
What are some of the intriguing stories you've heard so far?
So powerful stories. We're actually right now gathering the stories from nurses and doctors. We had a nurse, a senior nurse in Kumasi talk about families who did not trust and believe that one family member had contracted COVID.
Okay.
And somebody else who lived in the same house didn't contract it. So they would come in cars and trucks and threaten the nurse who was taking care of them and say, anything happens to them, we're coming for you.
Oh, no.
We're coming for you. And so we imagine the circumstances. One, the fear and the challenge of COVID itself. Then all the anger from the relatives who are scared for their loved one and see you as either the one who will save or the one who will lose if you don't save. So the pressure for those nurses and doctors, their stories haven't been told, and they must be. We must, as a nation, understand what our healthcare workers went through in dealing with this. They're still in it, but we have to understand it.
So how do the nurses and doctors bring their stories or join, participate in this?
So it's wonderful. We have a site administrator right here in Ghana. It's just on a Zoom, just audio on a Zoom. So you don't have to go anywhere. You can do it directly from your phone. It's very easy. We send you the questions in advance, so you know exactly what you're going to be asked. You can just contact us on WhatsApp. I was just about to say the WhatsApp. Can I say the WhatsApp number?
Yes, you say.
Yes. So the actual number went out of my head, so I'm going to do this number instead. So if they contact us on WhatsApp only on 026 468 5011. So 026 468 5011. Just literally send a WhatsApp. I'm a nurse, I'm a doctor, I'm interested in the Black Frontline, and then I'll pass your details on to our site administrator who's right here in Ghana.
All right.
Who can take your stories.
Okay. Thank you very much, Esther. So as you heard Esther Ama say, if you're interested, just take down the number. The number is actually on your screen right now, 026 468 5011. Just send a message and tell them you're interested. I think you should be interested because the stories have to be out there. And the good thing about it is that it's going to be anonymous. It's just your voice. Mm-hmm. So your face isn't going to show, your name isn't going to come up, so you don't have to worry about your superiors having issues with you. Thank you very much, and I wish you all the best in this project.
Thank you. Thank you so much.
All right, stay tuned in. We're not quite done yet.